Hello again. The 12th National AIDS Conference is now underway under the theme Unite for Change, Empower Communities and Redefine Priorities for HIV/AIDS. The interview, well, we're going to talk this evening to one of the people who, in fact, who are quite involved, especially from a research perspective with the program. Dr. Candice Chetty-Makkan. Makkan is joining us now, senior researcher with the Health Economics and Epidemiology Research Office. Good to have you on the program this evening. Doctor, grateful for your time. So just a few months ago, there were statistics released painting a worrying picture for some in terms of HIV/AIDS or HIV prevalence in South Africa. And they said at the time that more than 8 million people living in this country were confirmed to have been HIV positive. 6.2 million of them, thankfully, are currently on treatment. At a very basic level, why are we still seeing an increase in infections when so much time and money has been spent on awareness campaigns?
Yeah, thank you for your question. I think one way we could look at this is that from the estimates of 2024, we actually have approximately 140,000 new infections, which is actually a noticeable decrease or decline rather from the previous years. So what we need to think about, and I think that's the focus of the conference as well, is that how do we reprioritize our priorities for the HIV programs, taking into account some of the challenges that we've recently faced.
And given that context then, how much is the conference able to achieve when you look at the broader work that needs to be done? How much can be achieved during one conference in setting, if you will, a roadmap to get to where we want to be?
Yeah, thank you for that question. I think as we know that the conference is taking place over from the 8th to the 11th of September, and we have different plenary sessions, and the focus that the different speakers are going to is going to be around reprioritizing equity and access. How do we sustain HIV prevention? And also, how do we promote innovation, but by still putting those who are most vulnerable to HIV first? So through the different plenaries that will take place from tomorrow, including the different tracks that will be covered, we will be discussing those different topic points and especially trying to look at how we redefine the priorities for HIV/AIDS.
And just, Doctor, as someone who's been in the space for the years that you have been, how do you begin to answer the question of redefining the priorities? What should be the shift?
So currently we have seen a lot of disruptions to HIV prevention and treatment. However, we have had several successes through our HIV programs. One of the things that we need to think about is how do we sustain having our HIV prevention and treatment programs supported. And I think that would be the shift that we need to think about.
And any breakthroughs in the pipeline? Because for as long as I can remember, that has been the pursuit. I mean, the ultimate goal has always been to find a cure. But are there any breakthroughs that we can look to in the absence of an actual cure for HIV?
Well, one of the things that I can mention is according to some clinical trials that were done in South Africa, lenacapavir is an injectable HIV prevention option. And that's something that's quite a breakthrough and something new. And this is where people are able to take an HIV prevention injectable every 6 months compared to other prevention options. So those who are struggling with taking a daily pill, this will benefit them in terms of an injectable option. So that's quite a new breakthrough.
But on lenacapavir, the caveat at this point is that it's yet to get approval for dispensation in this country from SAPRA, which is the medicines regulator. Do you think there's anything at this stage that might stand in the way of that happening? Because the health department, for its part, says it's truly ready to roll it out at about, I think, 300 public health clinics. This would be from April next year until about 2028.
Yeah, so to my knowledge, there are a lot of global and local efforts that are working towards rolling out lenacapavir in 2026.
And is there anything about the medicine that you think might stand in the way of SAPRA approval?
Not to my knowledge at the moment. We are working off the results that came through from the clinical trials. And like I said, there are both global and local efforts to ensure that we're able to roll this out in South Africa.
And there are the cuts in US funding for HIV/AIDS programs, which had worried people in many communities, even within the research space in South Africa. There were concerns about what that would mean. I wonder how much that has altered the ability of local researchers to do their work, and perhaps even more longer term, the ability of the country to effectively respond and stay ahead of the curve, even in terms of academic understanding of the illness.
Yeah, and that is true. There have been significant disruptions to HIV prevention and treatment programs, including the clinical trials and studies that we have been conducting. And I think what we need to be cognizant of is that we don't really want to lose the advancements that we've already made. So we need to see how we can sustain some of the work that we've already done through our HIV programs and see how we can reprioritize again both the access as well as the research that we're conducting in the country.
Dr. Candice Chetty-Makkan, good to talk to you. Thank you so much for your time. She is the, I want to get the correct title here, the conference chair of the 12th South African AIDS Conference that's now underway from today. The Deputy President of the country, Paul Mashatile, opening the gathering. Lots to talk about between now and the end of the week on that score.